Okay, we're ready to go.
Thank you, Dr. Mast. Good evening, everyone. My name is Deborah Illig, and I'm very excited to introduce to you this evening Dr. Ebony Green. Dr. Ebony Green is a registered nurse and holds bachelor's and master's degrees in healthcare administration from Bellevue University. She completed her PhD at Capella University, where her primary focus was also healthcare administration, with an emphasis on family and frontline caregiving. Dr. Green is a core research faculty member for the Doctor of Healthcare Administration program in the College of Health Professions. Dr. Green has extensive experience focused on caregivers' health and wellness, with an emphasis on caregiver stress, burnout, and related family conflicts. She is the author of 3 books that focus on caregiving. Over the years, Dr. Green has contributed to a number of publications and given presentations that focus on how to train, assess, and support caregivers throughout their caregiving journey. She hopes that communities benefit from her firsthand knowledge about the importance of self-care while caring for someone you love is an ultimate benefit. It is with great pleasure that I introduce to you this evening, Dr. Green.
Thank you so much. That introduction made me sound a little fabulous. I'll take it. I do need to have an opportunity to screen share.
It should be all set.
Oh, there we go. Okay. So first of all, thank you very much for giving me an opportunity to speak about something that I really am passionate about, and that is caregiving. I started my career as a nursing assistant and then was working my way through my nursing degree and found out about a program for long-term care administration and decided to go in that direction. And as I continued my education, I worked as a admissions nurse for a long-term care organization and started to learn about the challenges that families face of maybe not knowing about the complexities that are involved in caring for an aging loved one. And at this particular facility, we also had a continuum of individuals who maybe had developmental disabilities and they were aging, or they maybe had some type of an accident or mental health issues that were requiring a long-term care solution. And so working with the families was really interesting and brought me to the idea of the need. And so this was in the late 90s that occurred. So I'm going to talk to you a little bit about why caregivers need support. A lot of things may be things that you're aware of, but maybe haven't had an opportunity to look at it in this context. So the first thing I want to say is that a few years ago, I had the opportunity to be interviewed by someone for radio. I think they were in Ohio. And so I was kind of stumped when she asked, well, you know, caregiving is something that is normative. So we've mainly been in families providing care as our loved ones age, either through intergenerational homes, and, you know, folks lived on farms and things of that nature. And having a grandparent or a loved great grandparent was normal. So what's changed? And that really brought me to the thought of, when I was growing up, I maybe was 3 or 4. I remember my grandmother caring for my great grandmother for a summer. And my aunt, who was also a nurse, she lived on the same block. And then up the hill, just up the hill, maybe a block and a half, my paternal grandmother lived up the hill. And so you think about that close proximity and how in the past we were all very, families were close, may have lived in the same neighborhoods, may have lived on the same piece of land. For some folks that still exists, but a lot of us have family members who are miles away, including parents. For me, my mother is in California, my father is in West Virginia. So, and I'm an only child. So you kind of think about those aspects of things, and you can understand why it's more complicated these days. The other thing is that if you look at the National Alliance for Caregiving and AARP, 68 or 58% of individuals are caring for a loved one who has complex medical needs. So again, in the past, we weren't living as long. And so we maybe didn't have as many complex medical needs. These days, when you have a person who maybe has an increase in their need, we can really provide that care at home. You can have all types of health equipment brought into the home. And so it's really about your capacity to provide that care that maybe separates someone who would need to be in a long-term care facility for a time, or who would choose that they want to move to another place to receive care. Another consideration is that oftentimes it can feel like a thankless job if you're providing care for a loved one. We're not always having that opportunity to choose whether or not we're going to provide care. And then even if we do make that decision, meaning when I say we don't have the opportunity to choose, is that circumstances choose us often with caregiving. And so if your loved one has a need, then it's not that necessarily that you want to become a caregiver, but you want to meet the need of your loved one. And so oftentimes those folks that we're closest to, think about your spouse or your siblings or your parents, if you're having a frustrating moment, you're more likely to be yourself in that frustration with your people you know. And then, you know, when the staff comes in, you can be nice, but you're frustrated with your spouse or your family member. So oftentimes folks feel that they don't have a choice in the role. And they also feel as though your loved one is frustrated. And maybe that has more to do with your loved one's ability to do certain things that he or she is no longer able to do, but it can feel like a personal attack. So that's very challenging for a lot of us who are caring for a loved one. The other consideration is it's a long-term situation because often there's a medical crisis that occurs. So, and that medical change or that medical need is not only present now, but that situation doesn't change, or the need for care doesn't decrease. So you may have additional things that now you're taking on, but then as far as the role, you're doing that from now until your loved one is no longer with you. And I find that even in our family, my husband and I have had a number of caregiving situations, most recently my mother-in-law, and we cared for her for about 3 years. She was also an LPN and very active and everything, and then had a terrible, I don't know if you all remember, a few years ago, there was a terrible strain of influenza. And so she got that, and she already had some pre-existing conditions and was on a ventilator. And so it took time for her to get off of that and to go to an acute care facility, and then a long-term care facility, and then finally home. And so she never did fully recover from that. And so we were caring for her throughout that entire time frame. And so as each crisis occurs, a lot of times you don't have an opportunity to adjust to that. And so I also find that even in my own situation, you find that you have that residual grief, or maybe find later on that you've got a post-traumatic response because you weren't able to deal with some of the things as they were occurring. So it's complicated there. Also, most of us don't give up, don't have an opportunity to fully focus on just providing care for a loved one because we have to still work. And for you, you may be working and caregiving and going to school, And so, you've got a lot there on your shoulders. So we look at the majority of caregivers spending about 24 hours a week providing care. And the median is about 10 hours a week. That's in addition to everything else you're doing. And then that 1 in 3 is providing 24 hour or 21 hours, but they're also working full time. So working 41 hours at work. And so that over time, again, you see that it can be very difficult to find a rhythm to providing care and also caring for your loved one. So that's very complex. As I mentioned, we know that caregiving often requires a long-term commitment for a relative who's maybe not a spouse or parent. This may be 6 years. For a parent or in-law, it might be up to 4 years. For non-relatives, 2 to 3 years is or 2.3 years is the average. So these are long-term commitments, and it can also be a wide range of roles and responsibilities. So maybe you're helping with independent daily activities of daily living, like cleaning and medication reminders, or getting those things set up, or doctor's appointments. And then some caregivers are also providing the personal level of care in addition. So that is very complex and challenging. And then you're doing that with working, and you're doing it for a period of time, and you're doing it for someone that you love. So there's always that level of concern too. The other consideration is that it can be lonely. And I know during this pandemic that it has been really challenging for not only the individuals, a lot of our seniors feeling very lonely and isolated, but also caregivers who are, working from home. You're also caring for your loved one at home. Everything is happening at home. It's you're not necessarily getting an opportunity to do those things for yourself that maybe you were able to do to relieve your distress. And so it makes this again, it can be complicated. Now, not all caregiving situations are lonely or really, a complex situation. And sometimes that really depends on your sphere of support. I think it would be much more challenging for me to care for my father. He's a military, was an officer in the Marines. He still, I won't tell you how old I am, but he still thinks of me as the baby. And so there has been situations where he was very sick and he's, oh no, everything is okay. And then I open Facebook and my uncle is like, Jose is life flighted, to the Cleveland Clinic. And I'm like, Dad, I just talked to you and you said everything is okay. And then my mom is a lawyer. So you can only imagine how complicated that whole personality is. And so she's not going to tell me everything either. So I sometimes think that what has been a blessing for me is with my husband's situation, he has siblings and we all have had good relationships. So we really were able to find our strengths, and then each person care for mom from a level of their strength. So I'm the nurse, so I can definitely talk about meds and what the nurses and doctors are saying. My husband is really good with communication, and if you need someone to go in and get things straightened around, or financial aspects. So we were able to kind of, do those types of things, and that made our situation a lot less challenging. But when you're doing it alone, or if you don't have that support, it can be really challenging, I think. One of the other things that I think is important, especially for those of you who are, most of us on the call, we're working in the healthcare field in some capacity. And so even if you're not thinking about yourself, but the programs you are, the services or programs that you're offering to patients or clients, start thinking about, I hope that you will start thinking about how to integrate some aspect of support for caregivers, whether it be your employees or if it is the individuals that are your patients and their families. So just kind of looking at that, because we look at this slide and it really talks about how there's not a lot of, and it's getting a little bit better. We heard some really good things from the State of the Union about caregiving that haven't necessarily been brought up in the past. But this is really great because while there's an increase in elder care benefits, only 3% of organizations in 2016 were actually offering geriatric counseling, onboarding, assisted living assessments, things that you would need to ease your ability to find the resources and support for your loved one. And so this is, a very low number. We're starting to see more organizations understand the need, but we're still not necessarily seeing solutions or engagement with regard to how organizations can address both their employees and if they have patients, if you're a direct provider, how to support both the patient and the family caregiver. So I think that the big idea here is that we want to value both the care for our paid and unpaid caregivers. And so the National Domestic Workers Alliance says that many paid caregivers are excluded from workplace protections. And what I'm talking about here is a lot of the frontline direct workers or individuals who are working in home care do not necessarily have the opportunity for paid time off. And so if you have a major crisis in your family, that can be the difference between, making it and then maybe being in a poverty type of a situation. And so there's a new insurance program. I hope we see this launched nationwide, where the nationwide insurance has a compassion, and the Compassionate Benefits Society, they have a program where individuals can actually, and I think they're only in 19 states to this point, but individuals can actually opt on, like if you were opting for your insurance or your long-term disability, and this, you pay a certain amount a month, and this insurance then gives you 80% of your income for that 3 months that you would that would coincide with your Family Medical Leave Act. And so this is a great step. It's just something that's been introduced in the last year. And so I hope we see more states and more organizations take on these types of benefits, so that when families do have major medical crisis situations, that you don't end up not having income or having to use all of your savings to make it through that one medical crisis. Again, just kind of think about those things, not only for yourself, but also for the clients or employees that you have. So one of the things that I got to do in the last couple of years is, before COVID, is have a summit on caregiver wellness. And so we had the summit, we came up with some ideas, and then we did a research report. And so I'm going to share a couple of things from the research report about what caregivers feel that they need to be effective. And so we had 170 respondents that responded to this question. And we wanted to know, what tools and supports do you need to be effective? And most caregivers say training. And so most of you are probably aware of the different levels of training that are available for frontline caregivers. And so there are some things that are really good strengths for those types of programs, meaning that they can offer a foundation. But these, on the subsequent slides, there's a couple of things that the caregivers identified that are in addition to what you would normally see, like in addition to the 76-hour nursing assistant program. So they not only talked about access to training, but self-time for balance. Couldn't we all use that? Access to mental health. I think that there's less stigma now, but it's really important to identify when you are experiencing that real deep distress. When my mother-in-law passed, I don't think that I processed that. I just filled my plate more. I did more stuff. And then about a year later, and it wasn't a full year, maybe 9 months. I had a period of a couple of months where I was crying about anything and everything. And I was just so overwhelmed. And I remember I went to my husband and I was crying and he was like, well, what's wrong? And I was like, I don't know. And I really didn't know. And so I started seeing a counselor, and, it was because the whole process of having my mother-in-law here for, 20 years. And so as I mentioned earlier, my mother is in California, so I only see her. I talk to her all the time, but I only see her periodically. So having my mother-in-law here day in and day out, it was less, I didn't have to long to see my mom as much. I was very happy when I saw it, but for my kids and such was really great. And so you sometimes are so busy, and I'm saying this to you as busy professionals who are either caring for someone, you have, someone who is, that to not be afraid to admit when you need to reach out, or when you've reached your capacity and you need some help, because it really has changed my perspective and ability to cope and find new and meaningful things. And so other caregivers need that too. And then of course, social support and so self-time, access to mental health and social support, I really put that in the category of wellness. And so those are the two biggest areas that came out of the study. 3 other important things that caregivers said that they felt was a need, an area, is to teach patience and kindness. And so if there's a way for you to integrate this into the work that you do, again, this would be very helpful to our healthcare system and to the caregivers. So basically what I'm talking about is making sure that, and I don't know, and maybe when we get a chance to chat a little bit, I don't know if there's a way to really teach empathy. There are strategies and approaches that can be effective, but I think sometimes in caregiving, knowing what to do in a crisis situation is our go-to learning mechanism, or what we've learned. A lot of us in healthcare, we are so calm during the crisis situation, and then it's after, when everybody else is freaked out, and then you've maintained that calm in the crisis situation. Now they're off calm and everybody's off doing their own thing, and then you can't figure out why you're freaking out. Well, you are probably just now processing, because that's what we're trained to do, is maintain calm. So I think that that's something that is important to what we do, but also to just make sure that there's a focus on mutual respect among your staff who are caregivers too, and treating each other fairly. And then also having individuals that could help provide support in a peer situation for distressing situations. I think we develop those types of relationships a lot of times in our in the work that we do educationally, and so it's something to think about for our roles moving forward. And then caregiver mentors should be certified and educated on resources and crisis management. So these are things that caregivers said at the summit and then expanded on during the survey that we had open. And then we want to implement tools and resources that are supportive for caregivers for wellness. What I find is that when when I've been a caregiver, when I'm having the most thoughtful process or I'm thinking the most is when I lay down to go to bed. Am I the only one? Probably not. So we developed a tool that is called the Emma tool, named for my mother-in-law that I was talking about. And Emma is available 24 hours a day, 7 days a week. It is a strengths-based tool based from my research from my dissertation about things that are the 9 components of wellness. And so what we do is ask some questions, and then you click on the submit button, and Emma will say, hey, you're doing really well in this area. Maybe it's your financial well-being, you're doing well with that, but your spiritual well-being, you're not, this is an area where you can improve. And here is a downloadable resource. And here are a bunch of other resources that are specifically geared toward helping you, the caregiver, improve your well-being. So rather than this being about what can you do for your loved one, well, you're probably already doing that. What can you do for yourself? I worked with a national organization that one of the slogans was take care. And I love that. But a lot of times caregivers don't know how to take care, where to start. And so this is just a starting place. You can come back and take it again, and you may have a different result. We hope you do. And then there's another area, but just having a snippet, one thing to do, one thing to bring you to additional resources can be very, very helpful. So I hope that you at least take a look at Emma. And if you don't have a resource for your caregivers, it's free. It's designed with love and research, and it's there for caregivers. The other thing is that caregivers are really wanting to make sure that they have access to training courses. The organization that my husband and I co-founded is called Caregiver Support Services, and we're a nonprofit organization. And so we used to provide training in person. I used to do that for 12 years, provide nursing assistant, medication aid training for families and then individuals who were part of the respite program here in Nebraska. And so I gave that up a few years back, and my goal was to start with online training for caregivers. And so we've got our first 3 classes up there, and they're really based on what were the things during the actual in-person training that caregivers felt were the most insightful things or things they didn't know about. So I started with like normal aging, infection control, and preventing dependent adult abuse. So those courses are now available there. I'm really proud of that. I'm really excited about that. And then one other thing that we have available on our site is our member forums. And you can just join a forum. And the forums are designed for caregivers to kind of chat back and forth. You know, you have your Facebook, but sometimes when you're talking about real personal situations, you don't want to necessarily be tracked, and you don't necessarily want everybody to be able to see what you're saying. So we have some private member forums there to really try to facilitate good conversations for caregivers. Okay, so I feel like I could just talk and talk and talk. So I want to thank you for spending this time with me, and I want to open it up for questions about anything caregiver related or career related or what have you.
Awesome. Thank you so much, Dr. Green. Just listening to your presentation definitely had me reflecting back on my caregiver days. And I think one question that I have just listening is a person that's being just thrusted into caregiving without any notion, what recommendations or strategies would you suggest for an individual to access? I mean, we hear so much about long-term care facilities, we hear about assisted living. However, if the individual that you're caring for does not meet the eligibility for those particular services in the community, what's left? So that caregiver is left trying to put pieces together to support that loved one. Do you have any recommendations for caregivers at that point?
I do. I think that that is more often than not what we see is that number one, most folks are going to want to stay home, even if they do have the option for long-term care. The other thing that brings me back or makes me think is when I was working as a admissions nurse, that was the thing that really prompted me, because families would not understand that Medicare was not going to pay for their loved one's long-term stay. And so you may have a spouse that was the primary breadwinner, and that person is going to need long-term care, and so they have to apply for Medicaid, and the other spouse had the lower income and they're still living at home. And so we know what those dynamics are going to look like. So one of the things I try to do is, especially like if you're listening right now, is to have the conversation with your family. And what I mean by that is really continuous conversations. So if you go to the Caregiver Support Services site, you'll see that there's a 1 through 5 step process. And that talks about developing your plan. And it walks you through, and there are resources to help you develop a plan and get the information. On our resources and guides page, there's also a guide that I have the pleasure of developing for an organization, and it's called Right Conversations. And that walks you through the whole process of what questions to ask and what you can do. As far as the financial component, I always find that to be the most challenging, because if the individual if your loved one doesn't have an insurance program that they can benefit, like have a long-term care insurance plan where they could actually have a family member or someone provide care and be compensated, then you're in that situation of maybe having to choose between someone in the family giving up employment to be the primary caregiver if you don't have one. So there's not an easy answer. It's usually all about the pre-planning process and educating the community before they would need those services. And that's what we're trying to do. But I'm positive a lot of folks that you're working with, or that your organization works with, it's already, they've passed that point where they can really do good, solid future planning. So it's very difficult.
Definitely. And that brings me to like my next question, and I won't be the question hog for the evening, but it brings me to the question of at what age? Because at this point in time in society, we're dealing with the various age levels and individuals that are facing crises through life that may necessitate them tapping into community services and or support from caregivers at home. So it's almost like, at what age do you have that conversation? It's like one of those crucial conversations that people don't want to discuss because we're all fine right now. And we even look at it now through the pandemic with the coronavirus. People need support. So I think, like you said, being proactive and having those conversations early, just, scatting with your mate, your partner, your spouse, whomever, your children, how you want things to go, or how do you intend or envision your caregiving experience to be, and or being the recipient of care if necessary. What recommendations do you have by way of starting those conversations?
So since we've had a couple of caregiving situations now, when the first person in the family, which was my father-in-law, was ill, my husband actually left his job. He's the oldest, so that we could care for my father-in-law during that final year, basically. And so that was at the same time we started developing that conversation guide. And what I really recommend is make it fun, like have some wine and invite your siblings over and print out those forms that I'm talking about, and everybody fill them out. Because what I find is that grandma told me this, and she told my other sibling that piece, and she told my mom a whole different thing. And then after or during, that causes the most conflict. The other thing is that in that 5-step process, I have what's called the spiritual gifts questionnaire.
Mhm.
And so I would make it fun. Like I said, have some wine or some dinner, and then have everybody print out that spiritual gifts questionnaire. That asks you about things in a way that tells me what are your gifts related to caregiving. And that way I know Terrence, my husband, is good at the financial part. I can give a bed bath. I don't care who it is.
Mhm.
And if it's a family member, I'm going to be comfortable and do a really good job. My sister-in-law would never want to do that, but she's a great cook. So you know what to ask an individual. And later on down the line, when you have siblings, it's very hard later to get family involved. But if you have that conversation now, I know what your caregiving gifts are, and I know what your wishes are because I have it documented in this document. And we put those things away. And if somebody needs care, then we say, hey, we already know you can't get out of it. We already know you're good with the lawn care. So you make sure, even if it means that that person is just going to be paying for the lawn care, it's one less thing that everybody else has to worry about. So I just feel like that is so key. And that's what we did was when we had the first loved one need help, we were working on those guides. And so they're made real with realistic, expectations. And we got together and everybody filled out their information. That way there's no telling us later, no, mom didn't want such and such. Yes, she did. It's written down.
Thank you for your presentation. It's been wonderful. So during your search before you decided to just make your own website and figure things out, what was your experience like with, because obviously you found a gap, you found a need that you filled. So it's not that there aren't support services out there necessarily for caregivers, but what wasn't meeting the need that you felt that you needed to step forward? Are you finding that people are having, sorry, I'm not doing a very good job of formulating my question right now.
You're doing a great job of formulating.
It's been kind of a rough day here. Because I know that, that's always been something for me. I worked in home health care. So a lot of those, we had so many of those conversations. This may not be a tomorrow decision, but you need to think about it now.
Right.
And when I'm looking for resources, lack of evidence-based things, I think was my biggest frustration. So did you find that was kind of what drove you? You were looking at other things and it just wasn't finding exactly what you wanted, or kind of what was your inspiration other than just having to caregive for somebody to develop this?
Thank you for asking. This was really in the 1990s.
Oh, okay.
And I was doing,
Way before.
I was doing admissions, and families were just so overwhelmed. And then you don't have a plan in place. And who's really thinking about the caregiver at that point?
Right.
And there really was no place to go. So this was in Iowa when I was in my nursing program and when I was getting my master's in healthcare administration. And my goal was to be a long-term care administrator. And then when we graduated college and relocated to Nebraska, I did a needs assessment. I actually put it in the paper, and I got letters and things from people finding out, was there a service here? And was there a need? And so it's really evolved over time from information to the assessment process. I find that a lot of people just don't know where to start when it comes to their self-care. The whole premise behind getting a PhD, I didn't want to, probably most of you didn't want to. Either you had an inspiration and someone inspired you to pursue your doctorate, and then you get into it and you're like, oh my word, this is so much. But I had a need. I felt like, as far as like you're saying with research and being able to back up certain things, being able to write grants. I don't really do that much anymore, but being able to write grants and things like that, I needed those skills. And so that's what prompted me and to even pursue a PhD. And so, and then adding in the training. And I feel like I did training in person for so many years. And now the industry, the market is just catching up to that need.
Right. Yeah. Thinking about, yeah, that you started this in the 90s, clearly you were ahead of the curve because, there is information out there now, definitely not as, at least from what I found, as evidence-based as what you're discussing. But yeah, in the 90s, there wasn't that out there. So yeah, you were definitely one of the first to come up with that. So fantastic. Yeah, just identifying that. Yeah, very connected to what you were doing, it sounds like, and being able to identify where you can make that. All right, wonderful.
Listening to the people, and we had at that time for like 9 years, we had starting in 2000, we had caregiver retreats here in Nebraska, and we called them the Tri-Cities. And so we had Council Bluffs, Omaha, and Nebraska, Omaha and Lincoln in Nebraska. And we would get caregivers from all over the state to come to that, and from Iowa too. And so listening to the caregivers themselves has been the most rewarding, and has always kept us abreast of what caregivers feel like they need.
Right, because that landscape has changed so much over the years.
Mm-hmm. Yeah.
I'm not sure if you do keep a close eye on the statistics for your website, and your services. I'm just curious if you found that more people are now, with the pandemic and being isolated and on quarantine and things, and not being able to face-to-face meet with people. Are you finding that you're having more traffic because of the pandemic, or has it been stayed steady?
That has stayed steady. I think that the things that people are wanting to talk about, that always shifts a little bit.
Sure.
So, and what I mean is like isolation as a topic of how to work through that, grief, not being able to visit family members, and how can you successfully do that if you have a loved one in a long-term care facility. So those have been kind of the topics that I've been doing the most talking about this last year.
Yeah, that makes perfect sense.
Dr. Green.
Hello there.
Hi. My name is Rupert Evans. I'm Dr. Rupert Evans, one of the faculty in CU. And I have a question about, do you deal with veterans? And in my case, I have a brother that's a couple years older than I am, and he has PTSD. He lives alone and should be in assisted living, but is goes adamantly against leaving his home and getting that kind of support. But he does get some support from the VA. He has a physical therapist that comes by, and he has a nurse that comes by and helps make sure he takes his medication, and a housekeeper. And there is nobody else really. I have a sister, but she lives out of state, and both of my parents are gone, and so I'm probably the only one that can help him. But how do you deal with someone who really doesn't want to be helped?
That is and as I was mentioning, I can relate, because my dad is a Marine, retired Marine, and so he doesn't want to tell me anything. And I also have a younger cousin who was in the military, and he was diagnosed with schizophrenia in the last couple of years. And so my cousin has been getting him situated and whatnot. He's quite a bit younger. The VA has a wonderful caregiver support program. And so one of the things that you may find beneficial is to check out their VA page for caregivers. It's just Veterans Caregivers. And they have a program that would help you with at least a few discussions on how, like debriefing and talking about how you can deal with the frustrations you may be having with getting him to access the care that he needs. And so they have a great program there. And then a lot of times, if you can connect through them, through the caregiver arm of the program, the services for your loved one can be greatly enhanced. And so if you can connect with them, that would be very, very helpful. Of course, we're always here for caregivers of any type, but they have a phenomenal caregiver support program. And I bet they could give you some, they've probably seen a lot of folks with PTSD. And I bet part of your brother's apprehension is that with post-traumatic stress, even being able to just watch the same movies, because you know what the end of the movie is going to be, so that decreases your distress that you would have. So having an environment that's familiar to him is probably, he doesn't necessarily know how great it could be to have other people to be around because the anxiety would be so high. But they have an excellent program.
Thank you very much.
You're welcome. I feel like I just talk and talk, boy. I could just talk and talk and talk.
Dr. Green, it's Deborah Illig again. One of the comments / questions that I wanted to raise to you is, as you were talking about, getting together, having a beverage, having dinner. My mantra to my family, which is filled with clinicians, is we need to have these kinds of conversations early and often, and preferably on a good day. Because when someone is not having a good day, or we are not having a good day, the energy, the emotion, the drama, if you will, can truly cloud what may be, the need for a very well laid plan. And so can you talk a little bit about how you pierce that ceiling, if you will, of talking about something that's difficult well in advance, so that it doesn't get to be a burden? Because once you have the plan, would you agree it's such a relief?
Mm-hmm.
And granted, nothing goes perfectly, but at least you have a plan and you can work the plan if and when circumstances arise.
Well, that is a great question. The Right Conversations Guide actually has things that you can use. It has a script basically that you can use to get the conversation going. I would also say that it shouldn't be a one-time deal. That's a lot of pressure to put on yourself we're going to figure out everything, or we're going to have this really deep discussion. Once you get to that second beverage, it's probably time to table that and have the fun. But at least you're getting a little bit at a time, and that way, no matter what, you have a foundation. I feel like to get those things that are most distressing out of the way, like where are certain items of paperwork, that's a nightmare if you've ever had an emergency situation. Does an individual want to have a do not resuscitate? My father-in-law, he had an abscess, a tooth that was, got infected, and it went through the bloodstream and the whole nine. And he was in Aberdeen, South Dakota, which is a nice jaunt from Nebraska. And so before we could get there, another family member got there and said, oh, he just take him off the life support. He wouldn't want to live like this. And we're like, absolutely not. Don't take him off the life support. And, we're here. But it took a couple of days for them to find my husband and for us to get up there. So at least knowing, who to contact and what the preferences are for DNR and under what circumstances, so that those emergency things are at least laid out, and then moving bit by bit through additional preferences. That would be my suggestion.
Great. Thank you so much.
You're welcome.
Dr. Green, could you share a little bit of, from your perspective of how caregivers in healthcare settings like hospitals, emergency rooms, clinics, what are some ways that they can support the caregivers at home?
Thank you. I think that the first thing is acknowledging the family member, the caregiver, identifying who that person is, listening to them. Because a lot of times, especially in folks that have been in this role for their loved one for any period of time, they don't always have a clinical thing to point you to that is happening. They may have a feeling, or they're watching their loved one like a hawk, so they can tell that there's something that's just not right. And so valuing their opinion and what they're telling you is very, very important and empowering. And I've had experiences where I wasn't listened to, and it was so distressing. And especially, a lot of us, when we go to healthcare providers, we don't tell them we're nurses, or we are, have a PhD or have a DHA degree. We want to go in there and be cared for. And so I think it's really, it's really hard when you have a practitioner that doesn't listen to you, and you're knowing your loved one or you're knowing yourself. So I think those are the things that would be: acknowledge them, listen to them.
Thank you.
You're welcome.
Dr. Green, I have one other question for you, and that is, in light of the pandemic and how it is that people have really begun to remove the curtain, if you will, as healthcare providers, do you find over the past 14, 15 months that healthcare providers / workers have become less stoic or more receptive to just admitting, I do need help, I am exhausted, I am not the mother, the wife, the sister, the daughter that I want to be? How are you seeing the effects of this long-term, set of circumstances that we're in, both personally and professionally?
I think people are, health professionals and caregivers, we are all experiencing some level of resilience fatigue. Like, we've been resilient, we've changed, we're masking up, we're social distancing, we're doing all of these things where children are at home learning, so we've had to adjust to that. And then also having the grief that we're experiencing, either because we've lost someone or because of the change in the way that we live day to day. And so I think a lot of individuals are not only more willing to ask for help, I fear that some folks are so overwhelmed that we won't necessarily know the full impact until a few years from now. I wonder about folks who are going to who have had experience having a post-traumatic stress response and maybe not wanting to be in healthcare, and so the experience that we're going to lose from their firsthand knowledge of working through the pandemic. So there's a lot to unpack, and I don't know that we fully understand what the long-term impact is going to look like, but I do know folks are exhausted.
Yes, yes.
Dr. Green, my name is Robin Geiger. I'm the Assistant Program Director for Nursing here at NCU, and I just wanted to let you know that it was a pleasure listening to you tonight. I didn't have any questions for you because they asked wonderful questions, but you're definitely an inspiration. We really appreciate having you tonight. Thank you.
Thank you very much. I appreciate that.
Any other questions? Well, Dr. Ebony Green, oh, go ahead, please.
This is Tabitha. I don't have any other questions. I, as well appreciate your time this evening. It's been valuable, and I look forward to looking over your website and looking at some of the tools and resources that you have and sharing some of those tools with other people in the community that I know would benefit from them. I'm hoping that this type of information can spread throughout the communities, not just in specific states, but nationwide. We see so many different things at different levels throughout the communities. It varies extensively depending on what state you're in. And so I'm hoping that, I know it's no one size fits all approach to anything, but caregivers can feel empowered and be supportive to the individuals that they serve and their loved ones throughout. So thank you.
Thank you, Tabitha. And I do want to say that we have resources and guides. And so if you have a guide or a resource or a tool that you think would benefit caregivers, because we do have caregivers all over that we serve, please send me an email. It's just egreen@caregiversupportservices.org. And I can add your resource to our resources guide. And if you don't remember that, you can just, on every page, there's a contact us at the bottom of the page. So we're always looking for resources that are could be helpful to caregivers. And it's, something that update frequently. So, send over an email and I'll get you up there.
Awesome. Thank you so much.
You're welcome.
Dr. Ebony Green, thank you so very much for all of your insights. And this is such an important topic. We really appreciate your time.
Thank you so much. I really enjoyed talking to you. I hope I didn't keep you too long, because I love to talk. So this has been my social hour for the week. So thank you very much.
Thank you.
Thank you.
Thank you.
Thank
Good
you.
night,
Everybody take care.
Good night.
Good night.